Welcome back to Empower Indie Podcast. This podcast creates space for honest conversations about health, well-being, and community resources to help people in southwestern North Dakota live healthy, full lives. The Empower Indie Podcast is produced by Women Empowering Women, a nonprofit organization dedicated to connecting, supporting, and educating women to help them become the best versions of themselves. To become a member or learn more, visit wewnetwork.org. Welcome back to the Empower Indie podcast. Today we're stepping into a conversation that sits right at the intersection of medicine, lived experience, and what it means to truly feel heard in a healthcare setting. We're joined by Paige from Unwind, who brings a unique dual perspective as both a healthcare provider and someone living with an autoimmune disease. That lived experience has shaped not only how she sees the medical system, but how she shows up for patients navigating complex and often frustrating diagnostic journeys of their own. Let's get started. Can you start by telling us a little about yourself?
Yeah, so like you said, I'm a nurse practitioner. I work over at Unwind. Kind of specialize in a couple different niches, like the hormones, cannabis, weight, mental health, and then have kind of been diving into the autoimmune side of things too.
Okay, so can you explain what an autoimmune disease is and how they impact the body?
Yeah, so basically, an autoimmune disease is where your immune system is recognizing your own body's tissues as something that's a foreign substance, something that it needs to combat. And so you basically get inflammation in those systems, and different autoimmune diseases impact different body systems. So different organs, joints, brain, all of that.
So, at what point did your personal experience with autoimmune disease begin? And then how did that kind of shift the way you see medicine?
Yeah, so I not entirely sure where I can pinpoint, where symptoms started. It was kind of a slow burn. It started with honestly with just fatigue, and then over time symptoms kind of progressed. I would say around the time of my first pregnancy is probably when things really started to flare up. I started getting more symptoms. Honestly, a lot of them I kind of brushed off and explained away. And then when I went back to school to be an NP, learned a little bit more in depth on, autoimmune processes, started recognizing patterns in myself that I was learning about. And so then when I became an NP, that's when I actually did my own kind of diagnostic testing, uncovered autoimmune disease. And then from there, it kind of shaped my perspective on other patients' experiences.
Right. So, how has living with an autoimmune condition changed the way you interact with your own patients?
Yeah, so I think before kind of understanding what exactly an autoimmune disease feels like, um, you know, when you go to school, textbook medicine has a very different way of how you approach patients. It's, you do your diagnostic testing, you diagnose, you treat, you see them, in a couple of months. When I first started experiencing symptoms, I went to my primary and was offered a sleep study and an antidepressant. And I didn't feel that was right. And so just kind of understanding and feeling what that autoimmune process feels like in my own body, I'm able to empathize more with other patients and understand that labs may not pinpoint the severity of the disease or exactly what's going on, but I'm able to understand, at least to some capacity, that there's so much more happening underneath.
So, being dismissed in silent illness. So, many patients who have been diagnosed with an autoimmune disease feel like they were dismissed in the medical system while seeking a diagnosis. And you kind of talked about that, and I think it's important to say too that those providers that are dismissing, they're just taught in a different way, and really truly are doing what they think is the right thing to do for the patients.
Absolutely.
And so it's not necessarily that they are maliciously dismissing people, but it's more of
It's a systems issue.
a systems issue, yeah.
Mm-hmm.
Yep. So, what does silent disease mean to you in the context of both your own health and your patients?
Yeah, so a silent disease is something where your experience in your body isn't really projected outwardly. So, for
Mhm.
example, I woke up a couple days ago in a flare, um, and I went to work the past couple days. I'm here. It doesn't look like I'm dealing with anything or battling
Mhm.
anything, but the symptoms that I experience are very much real, and they're can be debilitating at times.
Mhm.
And so, from the outside perspective, it might look like I'm feeling okay.
Mhm.
And that leads to a lot of doubt and self blame, because then you think, well, maybe it is all in my head. Maybe I'm exaggerating my symptoms and it's not as bad, and I
Mhm.
just need to toughen up and deal with it. Um, and so I've had to really coach myself on that,
Right.
and not put as much blame onto myself,
Mhm.
and being more supportive of my body instead of fighting against it. And so that's the same approach that I have for patients too,
Right.
is that we need to support your body instead of fight against it.
Where do you see the biggest gap between textbook medicine and what patients are actually living through day to day?
I really, there's such complexity to, I mean, especially autoimmune diseases, but a lot of disease processes, and it's not a linear, fit into a neat little box picture, almost
Right.
always. Um, Labs may not show, what's happening inside the patient's body. They
Mhm.
might look just fine. That doesn't mean that the patient's feeling fine. And each system interacts so intricately with all the other systems in our body, and I think we kind of categorize each system in its own little, section, instead of
Right.
kind of looking at the full picture and understanding that, this hormone system is going to impact your thyroid or inflammation, and kind of connect those dots and look at the patient more as a whole person, and a full body,
Right.
rather than one system or one disease.
Yeah. I think something that I've really been fascinated with, kind of since kind of going out on my own, would be how much the GI system affects everything, and how much the
Yes,
hormones are affected by what
absolutely.
you eat, and how true it is that food is medicine.
Hmm.
So, what have you had to like unlearn medically because of what you saw in real patients or in your own body?
I think one of the biggest things for me is going off of reference ranges for labs.
Hmm.
For example, my thyroid patients, that reference range for a TSH, that thyroid hormone, is such a big range. Patients usually feel best when they're in this more specific range.
Hmm.
And so on paper, thyroid looks great. We don't need to adjust anything or do anything. But symptomatically, the patient, is describing symptoms that mean that their thyroid's not working properly. So we're still going to treat it regardless of what that, reference range looks like. So that would say probably one of the number one things that I've had to
Yeah.
unlearn.
What does effective self advocacy look like for a patient navigating a complex or confusing diagnostic process?
So the first of all, it's not always a quick answer, easy fix.
Hmm.
So, just having patience with the process, but also at the same time not taking one treatment plan or one answer as that's it, that's the
Hmm.
direction I have to go. I love when patients come in and they've done some research, they've
Right.
done some reading, they have ideas, they're like, I
Hmm.
read about this, supplement, is that something that we could consider? I love that, because that means that they are, informing themselves. And yes, my job is to do that too, but even with, longer appointment times, we
Hmm.
still can't cover every single basis.
Right.
So coming to appointments prepared, taking second opinions. If you don't feel like you're getting anywhere with the treatment plan that you have, get a second or a third opinion.
Right.
Same with like a hairdresser. If you go to, a five-star hairdresser, they don't do your hair the way you like. That doesn't mean they're a bad hairdresser. That just
Right.
means they're not
They're not the one for you,
they're not the one for you.
which is okay.
And that's, yeah, completely
Yeah.
fine. And so you kind of need to, I don't want to say shop, but you kind of need
Yeah.
to search
Well, and even
for
as a
that.
provider, I don't ever get offended when I'm not the right person for them,
Right.
because it means that they're not going to get where they need to go. And my goal ultimately is to get them
Exactly.
where they need to
Exactly.
go,
Whatever that looks like
even
for
if that
them.
means it's not with me.
Hmm.
and I think that when they do come with their ideas, it's so fun too. It's like interactive, and it's,
Mhm.
you know, you're bouncing ideas off of each other, and they're a lot more patient as well, I think, because you're accepting of their ideas. And if
Mhm.
that idea doesn't work and you offer something else, they're a lot more accepting of that as well. And it's more of a collaboration and a partnership. And
Exactly. And that's ultimately what healthcare should be.
right,
It should be, I mean, the patients, that is their body, that is their experience, it's their life. They should be in charge of their health. I
right.
shouldn't be sitting here telling them what to do with their own body. It needs to be a collaborative effort. I take my knowledge and my experience and education and provide, options and, treatment plans. And then it's up to them to,
Right.
make that decision on what's going to fit best for them.
Well, and I think I always try to add some safety things too, like if it really is something that has some red flags and they want to try a supplement, it's like, hey, we really do need to
Yes,
do
and
this other thing, and
exactly.
explain it to them. Like, I am absolutely okay with that option, but let's also do this because maybe we do need to get an ultrasound of your thyroid,
Right,
like
right.
those types of things,
Yes.
and just guide them safely
Mhm.
to finding the route that's the right one for them.
Yeah, absolutely. I 100% agree with that.
What does a good appointment look like to you when someone is coming in with symptoms that are hard to pin down?
I would say that they feel heard,
Mhm.
validated, and understood. That there is some sort of treatment plan in place, even if it's
Right.
small, even if it's, I have no idea what's going on. Let's start here and work our way,
Right.
through things. And then there's space for vulnerability, for them to share
Mhm.
things, for them to ask questions, to ask for clarification if they're not sure on
Right.
things, to have a second opinion if they don't feel comfortable with something that I'm recommending, to
Right.
ask about it, to
Mhm.
go home and think about it before saying yes to a plan of care.
Right.
And then just developing that trust and that relationship with
Mhm.
your patient.
And I think the having the compromise too of like, I am suggesting this, you'd like to do this, why don't we meet somewhere in the middle, and then we can always revisit it.
Absolutely.
So, what has your experience taught you about healing that you wish more people understood?
Um, I think one of the main things is healing is not linear. I'm probably the worst patient when it comes to being a patient. I want things to work and I want them to work
Mhm.
now. And I have pretty poor adherence with things because I just want to start feeling better and,
Mhm.
make progress. And so, it's something that you need to give time. You're going to have ebbs and flows. Yes, I'm better than I was before my diagnosis. That doesn't mean that
Mhm.
I don't have flares and I have my bad
Right.
days, but overall, my quality of life is better.
Mhm.
Um, and that it is complex. So sometimes, I don't have the answer right away is okay. As long
Right.
as you're working with the patient on, diving deeper into getting those answers.
Right.
Um, Maybe it's a root cause or causes,
Mhm.
and just figuring those out and working with your patient on, getting better and having honestly just a better quality of
Right.
life.
And I think that when you have that collaboration and they trust you and they know that when they have an idea you're taking it serious, or when they express a symptom or a new symptom or something else has changed, then there's a lot more patience when you don't know and you have to dig deeper and figure
Hmm.
it out, to not have, that judgment as a provider. You're kind of worried sometimes too of being judged that you don't know what to do.
Hmm.
And it's okay that you don't know sometimes, and
Yeah.
that you have to do more studies or you have to research it even
Hmm.
and figure out a good plan.
Yeah. And I think that for the most part, that is well appreciated by
Mhm.
patients to say, I don't know, let me research this and get back
Right.
to you because I'm not going to have all the answers by any means.
Yeah.
I'm still figuring out my own body,
Right.
So I think that
And I think it goes a long ways when you tell a patient, let me research it, because they're like, wow, you're going to research something for me.
mhm,
Like, I think that's pretty profound for them to
mhm,
know that you would take your time and go and research that thing for that person,
mhm.
and learn more so that you could help them.
Yeah,
I
absolutely.
think that goes a long ways too.
Yeah.
So, what would you say to someone who is currently in that stage of uncertainty, still searching for answers and not feeling heard?
Number one thing is be patient with the process. Um, be your own advocate. If you don't feel like you're getting anywhere, like I said, seek that second opinion. You shouldn't. our medical system, patients shouldn't have to be doing all the research on their end, but that is kind of the way it's set up. So do your research, come prepared with questions, um, and then, I mean, seek support. Family, friends, let them know how you're feeling. Make sure that you have that support there too, because that's your nervous system plays a pretty big role in inflammation and autoimmune processes, and to make sure that you have um, a stable nervous system helps big time too.
Mhm. Well, thank you, Paige, for helping us better understand autoimmune disease through both lived experience and clinical perspective. These are complex, often invisible conditions, and stories like this remind us how important it is to listen beyond the labs and the surface. Thank you to our listeners for joining us. Until us next time, stay informed, stay empowered, and we will see you on the next Empower Indie podcast.